one of our patients had a dislocated shoulder, so I helped with like putting it back in.
I stapled a bowel. I saw a cystic teratoma, which
Good morning, you guys, and welcome back to my channel. It is Shay Michelle, and I'm so happy that you're joining me today. First things first, follow me on Instagram. I'm getting a lot more active with my like med school post. But yeah, I'm so happy to be able to do a vlog from my own bedroom. I don't know, check out my last vlog to see like the change in scenery, and I hope it's my last depending on how I upload it. But yeah, but I'm back and I am on a 2-week elective for emergency medicine. I just finished last week my 6-week internal medicine block, and I did that in Santa Barbara, so that's why I wasn't here. But now I'm back for this short elective before I move on to psychiatry. And yeah, so basically right now it's 6:18 a.m. and I woke up at like 5:30 to get dressed, which is like a surplus of time, but I'm feeling well rested. And so I woke up at 5:30 a.m. and I have to be at the hospital or the emergency department by 7 a.m. and so my shift today is 7 a.m. to 7 p.m. Usually in the ER, it seems like most of the shifts are about 12 hours long. And then yeah, so but our schedules are like very unpredictable. Like today I have 7 to 7, and then tomorrow I begin my overnights. I have a whole surplus of overnights that I'm definitely gonna record, but like tomorrow I'm 6 p.m. to 3 a.m. but I'm really interested in emergency medicine, so I've been having a really good time there. And today I'm in what we call resus. Long story short, all the trauma cases go to that sector of the emergency room. The emergency room I'm at has like 5 different sections, and they basically are based on severity. And so like one section is the sickest patients but not trauma, and then another section is more like OB-GYN, like eye issues and something else that I'm forgetting, but it's kind of like triage like that. And so the area I'm in, like I just said, is the trauma cases. And so I'm really interested to see how today's goes. And today is my first full day in the trauma area, and so that's why I wanted to make a vlog. I am gonna be back in 30 seconds after I get my oatmeal. We have retrieved the oatmeal. Basically this has been my go-to the last few days, just because we don't get like breakfast at the hospital. Last hospital I was at, they were like really fancy, and so they would give us like catered breakfast and lunch. But the hospital I'm at now doesn't like, well, I don't even know if they really give breakfast, but I just know when you're in the ER, you don't get breakfast. Side note, I don't know if I actually did my complete intro because I was like so eager. But hi you guys, my name is Shay Michelle, and I'm a 3rd-year medical student, and it feels weird saying that. I usually say 1st-year medical student, which is pretty sad because I've been here for a while. It's 6:24 and I'm about to pack some snacks and then alright you guys, it has been a morning. Right now it's 9:24, so I've been here for about 2.5 hours already. 2.5 hours out of my 12, and basically the first hour I was here was pretty slow, but then the second hour we had like back to back to back. And so we had a patient with an SVT, which is a supraventricular tachycardia, and there was this cool new maneuver they use, but basically usually you don't, or you can use vagal maneuvers sometimes, because the main thing is you just want to slow the heart down. And then we had a few more trauma cases. We're waiting on another trauma case. Someone's coming via the helicopter that's gonna come to the top of the hospital and then bring a patient, but they're not here yet. And then yeah, basically it's just been really nice. The morning was slow, but it really picked up pretty quickly. And basically in the ER / like resus, it's very unpredictable. Like sometimes it's really slow, then sometimes you get like 10 patients at a time. But I feel like every time I've been here, it's like really slow, then all of a sudden you get like 5 patients within 5 minutes, and everyone's like, oh my gosh, there's so much happening. So it's going well. I will keep you guys updated. It is now 2:15 in the afternoon, so we're like, I got here at 7, so 9, 10, 11, 12, 1, 2. We are over 5 hours into my shift. I had to leave a little bit because I had to go grab some more white coats. Basically, when we begin this hospital or clinical era, we get more white coats because in theory, we may have to use them every day, but realistically, like, you don't really wear your white coat once you're in clinic. So but that's one thing. But ooh, I even took notes so I could tell you guys everything that I've seen. But there's been a ton of interesting cases come in, because remember I told you I'm in recess today. I get the most severe like trauma. So like when there's car crashes, people come here. So we had some people from car crashes. And let me go check my notes and see what else we have. Another thing that happens at the ER is that there's lots and lots of consultations. So basically we have to consult like internal medicine if we want to get a patient admitted for something, or we have to contact ENT or like surgery. And so one of the people we've done a lot of consultations with is ortho, aka like orthopedic surgery, because we have seen some like really severe broken bones today. And like when I say severe, I mean like broken half. And so you have to consult ortho, because the only way you can fix that is to get orthopedic surgery. And like they have to go in, do their surgeries, put like nails and screws to just put things back into place. And so sometimes a lot of things will happen in the ER, like just like stabilization. So the things that I've been able to like just stand in the room for is just seeing like different pins go in just to like get a grip on whatever bone or joint they want, and then they then roll them to the actual surgery room. So we've seen a lot of that, lots of consultations, which happens all the time, and more stuff. But I need to get back because it took me like 10 minutes to find where the linen closet was to get like these 3 white coats, and I know they're like, where is she? So I'm gonna get back, but yeah, I'm actually excited. There's a ton of stuff to do once I leave here also, so let's keep going. I'm in the hallway lost right now, or in the stairwell, because the elevators I usually take are like out of service. And then I went to the stairs, and the stairs don't go to the floor I need to go to. So I'm just trying to go home. I am finally leaving the hospital. They let me out a few minutes early, but just because they were wrapping it up. But the reason I was there so late is because they actually let me do a lot of things. One of our patients had a dislocated shoulder, so I helped with like putting it back in. In this hospital, we get a lot of like cirrhosis patients, and you can see the jaundice and like the real yellowing of their skin and the sclera in their eyes. There was also a patient, there's someone in here in this huge parking garage. And you guys know I get nervous when people can see me vlogging. Well, we had another patient that was extremely hypothermic, and so their body temperature was about like in the 80s, like 80 something degrees, or like literally 90 degrees. And so that's like so in that case, it's also a big discussion on how to warm them, because when someone's body temperature is low, you want to look at one, how low it is, and then that'll determine kind of if you use internal or external methods, such as like very like specific blankets that are used and contraptions that are put on the outside of the body, compared to like you getting like a bladder irrigation. That was a big conversation with our patient who was hypothermic. Another thing I wanted to mention, there was like a lot of car crashes today, and the people from them, but one person's injuries were so deep you can see their actual tendons on like their muscle tendons, you know? And so I don't know, after taking anatomy and understanding how deep that really is, that is a deep wound. I'm back in my room, and I was like cracking jokes because how dark it is outside right now is how dark it was when I left this morning, you know? So a 7 to 7 shift really did a number on me. I feel like I look tired, but it's fine. But yeah, just to give like a recap of the day, you know, recess was what recess always is. It's kind of like you have moments where it's so busy, then moments where it's not busy. You literally see everything from like different, like the aftermaths of car crashes to strokes, to there were like multiple people that we had to like rule in or rule out a stroke for, because with strokes, timing is like crucial. So you need to know, like, if someone's having a stroke, you need to take action immediately. Shoulder dislocation, that was probably the most hands-on I was for the day. And then I just learned a ton of stuff. We did a ton of ultrasounds. It was like a lot of teaching involved, just because a lot of the residents I worked with just really like teaching. which I like because then it's not like I'm just sitting there bored all day, and I can like actually learn and ask questions and stuff like that. That's what I did for the last 12 hours. We ate lunch and the cafeteria food was good. I was surprised. I was pleasantly surprised. Right now I'm eating some cute Trader Joe's snacks. Right now it's 7:12, and for the rest of the day, basically, I'll tell you guys what I should be doing. It's hit or miss if I do it, because I'm not gonna lie, because my last rotation internal medicine ended literally a week ago, last Friday, and today's Friday. I've been utterly exhausted. Like, I just felt like I needed a break, and so honestly I haven't done much academically in this week just because I was so tired. And internal medicine is like infamous for being one of the more intense rotations. But in theory, what I may do today slash what I definitely am going to start tomorrow is studying for like my next test, which is psych. The way I'm gonna study for psych is I'm just starting the flashcards. That's the first step for me. I'm probably gonna spend a day or two on the flashcards. I also was like Googling what people do to study, and they were saying like read your first aid book. So I'll probably just read the psych section in the first aid book, but mind you, it's pretty small, so that'll take me like an hour, maybe 2 hours, depending on how thorough I'm reading it. And then from there, we'll just do practice questions. Psych doesn't have nearly as many practice questions as internal medicine. Internal medicine had 1,000 practice questions, rather than I believe psych has around 300. So, you know, strategically I should get through that pretty quickly. But we're going to talk to more people tonight about how life is going. But yeah, that's kind of like what's been going on in the ER.
What you said to me really stared into my brain, and I just can't get over that.
As you can see, we're just sitting here chilling. So of course we have to ask some questions to finish the night. We have Manali and Neha. So the question of the day is, what do you think? How was your first rotation? How was your first rotation?
It's awesome.
Is that all you have to say?
I stapled a bowel.
You stapled a bowel?
Yeah.
Go, tell us more.
The bowel was already removed from the body, but they let me staple it anyways. Don't edit it! Don't edit it!
I won't edit it. It's
Thank
fine. Neha,
You're very close to me.
how was the last
Yeah, I
rotation?
was waiting for you to ask. It was fine. It was good. Okay, what did I do? I saw a cystic teratoma, which was very cool.
Tell us more. What's a cystic teratoma?
So, like a mature cystic teratoma, or like a dermoid cyst, it basically like is one of those tumors you hear about that has like hair and teeth growing in it in like a random part of your body. And I would, yeah. So
Where was it?
it was a gynecologic surgery, so it was.
Oh, okay.
somewhere-
And that is it.
Thank you to all the viewers. Yeah, like, comment, subscribe for our girl Shay Michelle by Fabletics Scrubs if you want.
And that's a wrap. Thank you guys for watching. Don't forget to like,